Hooray.
Yeah, and so I don't know much about your history. I read your bio really quick, and I just thought it was charming that your first words out of your mouth were not mama or daddy, it was your dog's name. So that is adorable. Who doesn't just love that? That was like destiny right there.
Definitely.
Absolutely. And it was a dog. And you are a fellow equestrian, which we love in this group. This is primarily a horse, holistic horse and dog group. So we love that about you. We know that you're the premier onco holistic specialist for dogs and maybe eventually horses. Oh, just welcome. Thank you for being here today. It's such an honor to have you on.
Thank you. And thank you for giving me the title of equestrian. I officially can call myself that now, so I'm proud of myself.
Yay!
Yeah.
Well, and I didn't know your horse was a stud, so that's extra like impressive and kudos to you. I
Oh
love
my gosh.
stallions.
Yeah, the optics are all wrong. First time horse owner, off the truck thoroughbred stallion, but I swear he's nothing like you think he would be.
That's insane. Oh my
Yeah.
gosh. And they thought he was Crypt Orchid, and you're like, oh no, you.
Yeah, yeah. And I was
That's
like,
so
great.
wild,
Well, let's
Kendra.
just keep him.
Dr. Kendra, I think that was meant to be, right? And you're like the metabolic woman.
Oh,
So you're
totally.
like, they stay. He's gonna have a better immune system. Yeah,
Absolutely. I'm like, he's perfect. We're not taking them.
I love that. He
For
fell
sure.
into the right hands with you. So how'd you get into canine oncology, holistic type approaches? Because I know you probably grew up conventional. So where did that like split?
Yeah. The passion for oncology came from a personal loss. People who followed my story know that I do what I do from losing my father when I was 22 very quickly to stage 4 colon cancer. And so I always knew that that was the space I needed to make a difference in. And I always knew, hence the dogs being my first word, that I would always be a veterinarian. And so kind of the bridge between the two and what that mission was going to look like took some time to evolve. But when I was in veterinary school at the University of Florida, I was exposed really early to non-traditional therapies. They have a very large integrative medicine program. And very quickly, I started to recognize different types of tools that were accessible: acupuncture, herbs, rehab, laser. And as I learned more and more in my education, there was just this aha moment from my personal experience with my dad, from starting to learn so much about the cancer patients and already being interested in them, that there was this huge need for extra tools in the toolbox. Like when you are fighting the most formidable opponent, why would you not want every single tool that you could have? But what has evolved over time is I started out with this just being like extra tools to help me fight the fight. But what I realized is that we've spent all this time learning how to treat cancer when we already have the cure for cancer. It's not to get it in the first place. And this
Right.
is a preventable disease that we don't look at as such. And so things have really shifted over time in talking about how to prevent this, because that's the real way to make the biggest impact.
I love that. Prevention is the best medicine. So how do we go about doing prevention?
Yeah. And this is a conversation that I've realized needs to be different based on who we're talking to. Because there's some people that don't even realize cancer is preventable. They don't realize there's anything you can do. This is like blowing their mind. That, they don't care about feeding real food. They don't think about herbs. But I know your audience, they're like the 3.0 pet parents. So they're already doing so many of these things. And with them, the conversation I find that I often have is they actually think that they're already doing it. And then they get really frustrated because they will be feeding real food. They'll be doing herbs. They'll be spending lots of time on, making sure that their stress levels are low and just that they're giving them the best life possible. And then they'll see their friends or themselves, their own pets will get diagnosed with cancer. And then they're like, nothing works. This is not a preventable disease. And so what I've found is that, quote unquote, how you do this, it has to be individualized. And that's why so many general prevention plans, air quote, don't work. Because our biology, cancer, this is a sophisticated thing. This is not like I got exposed to lung chemicals or I ate processed food or I sat in the sun too much. This is cumulative exposures over time that are changing things in the body that are allowing this to happen. And so, in order to find that true best prevention plan, it looks like digging under the surface, doing certain diagnostics, monitoring things over time because it's the long game. It's not the short game.
Absolutely. So I was trained by a human naturopath, and he
Mm-hmm.
would always discuss the layers, the multi-layers, so epigenetic aspect.
Mm-hmm.
So you may have a weakness, a genetic weakness that is just waiting to be triggered. My own family, I'm the youngest out of six. Five out of six have had cancer.
Wow.
I'm the only one that's never been technically diagnosed, but I'm
Wow.
very, very proactive because I'm the youngest and I watched everybody else go through it. So I
Yes.
too have a big, big passion for cancer prevention. So what, like detoxifications, good nutrition, you've got probably this arsenal of prevention. What are your thoughts on that?
Yeah. And that's exactly right. I love that you brought up epigenetics because this is like a conversation that can be very confusing. Even my conventional colleagues, I've gotten into challenging conversations with them. We're really made to believe that cancer is a genetic disease. And if people don't understand epigenetics, they're going to think it's a genetic disease. But what epigenetics are is how our genes interact with our environment. And if our environment turns on or turns off genes. And the things that's really crazy about epigenetics, which you might know, Poppy, is that they're actually inheritable. The environment that your parents and your grandparents' genes interacted with can be passed on to you. And so there's these really interesting studies that were done in Holocaust survivors, where they found actually that the grandchildren of the Holocaust survivors had significantly different levels of cortisol and blood sugar that were passed down to them from the experience their grandparents had. And we know what happens in animals. We've done studies in animals. And so it is how our genes and our predispositions, just like you said, interact with our environments. And I do think our canines and, our equines in some ways have higher risks than a lot of us dogs because of inbreeding, line breeding. We have made their genes a little bit more unstable than they could be by crossbreeding them through lots of different dogs. And when it comes to like equine husbandry, so many people know how many chemicals are around them constantly.
Right.
The same as our dogs. And so you're absolutely right that that is the big misnomer and the big myth that this is a genetic disease, it's a bad deck of cards, there's nothing that you can do. When in the reality is no, no, no. It's how that deck of card interacts with the environment that you give it. And so environment means a lot of things. It means the water. And if you're identifying the exact toxins and using the correct filter, because a lot of people aren't, we don't even realize what's in our water. It's the air. And that might not be the air pollution outside. Actually, our homes are some of the most toxic places, from our kitchens and building materials and furniture and plastics. That can be other types of toxins like mold and pesticides and heavy metals. And so there's lots, just like you said, lots and lots of layers that don't need to be scary and complicated, but do need to be personalized to exactly the environment that that animal is living in.
I didn't know that about the Holocaust genetic line. And I've
Yeah.
always suspected that, Dr. Kendra. I've always thought that emotions, like I've had friends
Yes.
that were very emotional during their pregnancy and their babies were really emotional babies.
Yes.
And so I'm a thinker, like I'm always like, huh, isn't that interesting? But I've always felt like I'm not into past life stuff, but I think that what people think past lives are actually genetic DNA memories passing down. And I think our genes pass all this data down, and sometimes you grab onto it and go, oh, that's a past life, when it's actually like great great grandparents lived in an Oklahoma farmhouse.
Yes. Yeah,
Yeah.
there's a name for it. It's called epigenetic inheritance, and it's 8 generations back. So that is
Gosh.
far. It is far.
That's
So absolutely.
crazy. I didn't know
Hmm.
that. Thank you for telling me that because watching friends and clients get organ transplants and having memories of the
Mm.
organ donor and
Wow.
also having dogs get fecal transplants and
Yes.
seeing a change in their behavior,
Yes.
it's just like there's something to this.
Yeah, absolutely.
That's
Yeah,
so
it's not
exciting.
woo-woo. It's science. Yeah, we've proved it.
That's so
Mm-hmm.
fun. That's
Mm-hmm.
okay. So with this knowledge, how do you prevent like the the Holocaust survivors with the extra
Yeah.
cortisol and adrenaline?
Yep.
They're like in this chronic like DNA torment memory.
Yeah.
So all that shock passed through
Mm-hmm.
into the next generation and the next generation.
Mm-hmm.
How do we stop that?
Yeah, exactly. And I love your analogy of layers because I feel like it's really working for everything that we're talking about. And some of my mentors, medical school, doctor of biology, that's all on the cell level, right? That's all
It's
on the
very
mechanism.
linear.
Uh-huh.
I call it linear. Yeah.
Yeah. And it's just on one level. But then that's forgetting about the energetic body, which is also not woo-woo. That's something that we can measure and that we know about and that we know affects the physiology of the body. And then there's also like the soul body, right? Which is a whole nother part, which is the emotional body, which we also know the emotions affect different things. And so I think that this is interesting that we're talking about this because so much of medicine focuses just on the physiological body, whereas there's actually a ton of research specific, to cancer, obviously something that I'm always talking about, where in people, if they don't treat the underlying emotional imbalance, like let's say it was someone that had trauma as a child, or someone that had trauma as an adult, or someone that,
Suppression.
whatever.
Suppression. I think
Yeah.
suppression is so toxic.
Yeah, whatever emotion it was, if that isn't treated as part of their biological cancer treatment plan, there will always be a relapse. And so they find that that emotional component is so linked to the physiological healing capacity. We hear people talk about this nervous system regulation. We hear people talk about this with like emotional freedom techniques and other types of emotional techniques. And so I think that the bigger question is there's different layers to work on in the body, and we can't let go that emotional component. And for our pets, our dogs, our horses, so much of their purpose and mission is aligned with us. And so I do think this is just an idea. I haven't tried this clinically, but I do think if we're really trying to heal that, it probably requires the owners to do some of their own healing too.
Yeah. The comment section, they're all lighting up. I was going to
Mhm.
say, often when I'm working on a pet, there's a matching issue. And I never
Definitely.
really, I always challenge myself to go, well, maybe there's mold in the house and everybody's like being poisoned by that or compromised, but also it could be a toxic environment of mental, emotional. And I also think a good attitude, a mindset, but words create worlds. So if you're being spoken to in a really negative way or you have your own negative self-talk, I feel like your pack animal matches that.
Definitely, 100%. And it's something that we don't talk about at all in veterinary medicine. And I think that when we're talking about these really significant disease conditions, or maybe something that's really stuck, like you're talking about, where we're having trouble curing it or eliminating it, I agree with you that it's really important to look outside the physical body and what else could be affecting it.
Dr. Kendra, do you pray for your patients?
It's funny. I was raised Catholic and like organized religion, and I lost my faith when my dad died, for sure. I didn't understand, how could this happen? How is this fair? Why? And I've come back to faith, but I think in a different way. So I wouldn't say that I pray in the traditional way that you pray, but do I definitely allow source, universe, higher powers to send me messages, to give me medical intuition, to allow me to help heal them, to let me feel things sometimes that I can't with my other diagnostics. And ask and offer them to help them too, 100%. Because I know that I'm just like one tiny little piece of a much bigger, bigger piece.
It's very humbling, isn't it?
Yeah,
And
definitely.
it's exponential. It's so interesting because I do pray before I muscle test, so I set a prayer of
Mm,
intention,
hmm
and then all the like pieces kind of like play out in front of you in a very dynamic and dimensional way, and you're just like, oh, that's so fascinating. So the fact that you feel like you're just one little like glimmer or almost like a little jewel in the jewelry box. I think it's beautiful.
And I think it keeps you really curious. I think like the big danger of when people think they know everything is that they think they know everything and they don't know what they don't know. And so I know even on my holistic journey, which definitely has included a lot of different spirituality, just discovery. It does keep you very humble because it just allows you to see how much more there is than outside of what you know, and that you can keep discovering that and growing yourself and learning those things.
It's overwhelming sometimes. Sometimes
Yes.
it's so massive. You're like, oh, let me like recalibrate myself to this
Yeah.
situation.
Yeah. I
Yeah.
agree. I agree, but it's good.
It is good. It's
Yeah.
exciting, isn't
Yes.
it? And I
Yes.
love that you're teaching it. So you have a course that rolls out for pet owners as
Yes.
well as veterinarians. So you have a CE course for veterinarians, and then
Yep.
you have a pet lover type course, correct?
Yeah. So, it was probably maybe 2 years after I had hired my first associate doctor, and I was like, oh, she can do this pretty good. And I guess I've explained to her the framework pretty good. And I started to recognize that it was repeatable. And I was like, well, and we would get phone calls very often. Can you help with this? Can you help with that? Can you help with this? But it would always be addressed the wrong way. It would always be, what's your protocol for this cancer? What's your protocol for that cancer? And they were always missing the point, which is we don't treat the cancer, we treat the patient. And so it became very obvious that in order for me to help all the patients that needed to be helped, the fastest way to do that is to help the veterinarians so that we can reach more patients. And it's really been amazing because there's so many of them that want to do this work, which is hard work, and they love this space and they love offering this information and these treatments for clients. But the but I that course, although very wonderful and amazing, still isn't solving the problem of preventing it. And so I was still just teaching people how to treat it. And what I really want to do is I want to teach people how to prevent it. And that's where I was like, well, this is where the pet parents can jump right in. And I don't need to teach the veterinarians this part. They learn it also secondarily through the program. But the pet owners really need to know what this looks like because there's so many of them that can't access these kinds of veterinarians that there's no reason we can't empower the pet parents to do it on their own.
I love that. And
And the course is awesome. I did it.
oh,
And
did
it's
you?
really
That's
helpful. It's really great.
I
Thanks,
love
Julie.
And
that.
you have lifelong access.
Do
Yep.
you teach it live or is it a pre-recorded?
It's both. So the teachings are pre-recorded, but there's live components to it. So we can kind of work on whatever owners are going through. I do have quite a few owners that take it while their pet has cancer, just looking for more answers. And then a lot of pet owners that have come to me because they've lost a pet to cancer and they just want to know how not to have that ever happen again. And so because it needs to be so personalized, that live component kind of allows us just to meet people wherever they are on their journey.
That's
And
fantastic.
it's super, super organized. And you get Dr. Kendra doing her presentation. Then you get copies of the slides to download, copy of the transcript to download, and then a zillion different resources.
Amazing. That
And a
sounds so great.
test, not a test, a test to see how good you are with your toxins and eliminating all the bad stuff.
Yeah, no grade. Nobody's graded.
Nobody's graded. There's
Yeah,
no
don't be
pass
And
or
scared.
I
Yeah.
had a
fail.
really good
You
low
fail.
number.
You're like, your
Yeah.
dog's not going to be healthy.
Yeah.
That's awful. You're like, you better pass because your dog's life is like
Yeah.
fully dependent on this. You're like, no. Oh my gosh, no pressure.
Yeah, exactly.
That's awful. So I'm excited. Um, how do we get involved in that?
So there's a couple of different ways. There are some free resources that if people want to kind of just like dabble, explore, there's a quiz that I have that's like a very, very, very condensed version of the big version you get in the full program. And it's just to start to like explore, like what is the risk that your dog has? And so that's a link that's very easy for us to share with your audience. There's also a free masterclass to just kind of share with owners a little bit more about this. Like if this is brand new to you, you're like, what is she even talking about? What do you mean cancer is preventable? There's a free masterclass where I talk about this and some of the top mistakes that pet owners make. So those are two good ways to get more information. For people that already know that they are like, yep, I want to do something like this. I want to dive deep. I want to learn more. All of those links we can provide for your audience so that they have them and that they can find it. Hmm.
Fantastic. That's awesome. Thank you for
Yeah.
that. I can't wait to go through that. Biohacking. Are we
Yeah.
biohacking our pets now?
I know. I know. And I don't know, do you follow Zach Bush much at all
Not
and his
not
standpoint on
that
this?
much, but I follow some other biohacking type
Yeah. I
people.
follow a lot of biohackers and I definitely have a sauna in my house. I have a cold plunge in my house. I have an aura ring. I have red light devices. I definitely do a fair amount of biohacking myself, but I always think about this one comment that Zach Bush made, and I saw a chat come in that's related to this. The only reason that we need to do all this biohacking is because we're so misaligned with the way we're supposed to live our lives. And it's
Bingo.
like if we
Wow.
just went back to the way we were supposed to live our lives, waking with the sun, walking outside, going in hot springs, going in cold springs, walking for our food, playing in the garden, getting dirt under our fingernails, being with animals, so many of our chronic diseases would disappear. And so, are we biohacking our pets? Yes, because we've removed them from the way they're supposed to live our lives. And so, I think that it is a good option for certain things, but in best case scenario, we all would just go back to the way we're supposed to be, right?
Terrifying in a way though for me. I've thought about it. I've thought about being like fully off the grid. I'm just like, no, I
I
can't do
know.
it. I can't.
I
I'm
know.
gonna
So it's
get
like finding,
lonely.
exactly. So it's like finding those things that we can do to honor the traditions, honor, our heritage and how it's supposed to be. And then biohacking the other stuff like that maybe we don't want to do. Yeah.
Yeah. Are you, in regards to nutrition, are you set
Mhm.
for a program? Like, I really feel like compromised dogs should be on maybe a gently cooked, whereas non-immune compromised dogs could probably go raw. But, lifestyle also of the owner can get complicated. What are your thoughts about that?
Yeah, and I think that what you just said, it's such an important point because it's nuanced, right? The answer is so nuanced. And this is where when people try to say like all raw is bad or all blank is okay, like it's never all or nothing, especially when it comes to nutrition because it does need to be so personalized. And I completely agree with you. I have had cancer patients on chemotherapy that have been fed raw their whole life and they cruise through on raw. I've had other patients that I agree with you. The raw does not do well with them either because of age, GI weaknesses, immune compromise, whatever. They need something more gently cooked. Um, the only kind of general agreements that I do have is that it needs to be species appropriate and it needs to not have carbs. And we need to limit as much as possible all of those chemical contaminated and mycotoxin contaminated ingredients because I see it constantly. We check patients all the time for mold and for glyphosate, and the levels are really, really high, even in some of the better commercial pet foods. And so our pets are being exposed to this stuff just as much as we are. And so we do need to be conscious of that.
Mycotoxin infused foods. Are you talking like corn or are you talking like sweet potatoes or beet pulp or
The
what?
most common offenders are the kibble-based diets because they have such high quantities of any of the ingredients that you're talking about. All of the corn, soy, wheat, pulps, all of those, because for people that don't understand kind of the process of food processing, these ingredients don't come whole. They've already been processed and stored by the time they go to be made kibble. And so they've been growing mycotoxins. It's actually the most common reason for pet food recalls is mycotoxins. It's not raw food, although that's kind of what the media makes us believe. And so the commercial kibbles are usually the highest, but I have seen fresh and gently cooked diets that contain rice, pasta, lentils, any grains. For us, oats, coffee, beans, unfortunately, a lot of them can be really high in mycotoxins too, just from storage. And so we do, and our horses, oh my gosh, our horses, the
It's
grain and the hay. Yeah.
so yeah, I'm sponsored by an organic feed company. So Pro Series Equine, I'll send you information on them
Yes,
because I
please.
love them.
Great.
And,
Yes,
and
please.
they're wonderful people. And Claire Thunes did all their um, formulation. She is UC Davis's #1 goddess of equine nutrition.
Oh,
So
awesome.
yeah, I mad respect for her. And so yes, I'll send that your way. I'd love
Yes.
to get your feedback, joke intended,
Yeah.
on that.
Fun. Exactly.
So on as you're talking about the mycotoxins, my mom died of mold.
Really?
Yeah, she died of
Wow.
mucor. And so molds, I read an article that blonde-haired, blue-eyed, long-fingered individuals tend to be more sensitive to mold. Is there
Wow.
different dogs or species that are more mold prone? Like I can hire some Hispanic guy out here and he'll dig through the mold and not have a problem where I have
Right.
to mask up.
Right. And you know what's interesting about that comment is it's like the genes that are causing the blonde hair, the blue eyes, and long fingers. What else is it changing? Is it changing methylation? Is it changing detoxification? Because those are usually the ones that have an issue that allow these like chronic immune cancers, things like that to be more common. And I'm a terrible methylator. And so, I understand our genetic weaknesses, like we're talking about, and the risk factors. And although there's very little literature about any of this, I guarantee you it's the same thing. And it's the reason why we can see one dog that literally eats out of a garbage can its whole life, never has issues, totally
Old
fine,
Roy,
live.
old
Yeah,
Roy
exactly.
forever.
Exactly. And then we have the dog that lives like the charmed life where the owner does everything they can and it's a mess constantly with everything. And so they do have those same epigenetic weaknesses like we do. And I'm sure that some of them, and I've seen it clinically, some of them are much more affected than other ones are from these levels. And I bet you it's the same in our equine friends. I know my horse has mycotoxin in his urine. I've tested him. And there's another
Where,
horse at the,
where do you get that tested?
oh, you can do it the same place you do all the dogs and the cats. So you can send
VDI.
it to VDI.
Okay,
And they
excellent.
send it to Texas to real-time labs.
Amazing.
Yeah.
Oh, one more thing to test with
One
the
more thing to
horses.
test. But the hard thing about the mold, which I'm sure that you know from going through this with your own mother, and this is true with all the pathogens. Just because they're there doesn't mean they're causing a problem. And just like you said, for some people, they can have mold buildup. It doesn't cause them an issue. For other people, it can be debilitating. And so that's what can be hard is because we're all exposed and our pets are exposed to these toxins and we're going to find them, but are they doing damage or not? And so it's a bit of the game of just doing everything we can to improve health as optimal as possible and trying to minimize those risks that we can control and control the controllable.
It's interesting because I have a gene for hemochromatosis
Oh,
and I am allergic to chocolate. I'm sensitive to cinnamon, but there's sometimes where I can eat that stuff. So it was a little bit like Russian roulette where I'm good, I'm good, I'm good, I'm anaphylactic. Like it was so weird. And then I realized they were really high iron foods.
Mm,
And so it was literally my body going, not one more ounce of iron is going to work for you right now. But
hmm.
when my iron wasn't building, I could kind of sneak by. And so
Yeah.
it wasn't even necessarily an allergen, it was literally more of a toxin.
Yeah.
And I wonder about that in our pets is I'm sure they're exposed to heavy metals and all sorts of crazy toxins. Like you just said, we don't know their genetic methylation other than like MDR1 and maybe a couple other things.
Exactly.
And so it's a whole new world and it's exciting, but it's also frustrating because in the back of your head, you're just like, I know there's something there.
Yeah. And a perfect example is copper storage disease. I mean, that is probably from the high amounts of copper that is in a lot of the synthetic multivitamins and commercial pet food. And so that's a perfect example of that, right? Where some animals, they're like, I cannot tolerate any more of this, and my liver is not functioning anymore because of this. And other dogs are like, we're okay. We are fine with this amount of copper. But this is exactly back to kind of what we were saying in the beginning. This is exactly why it is so complicated and why it needs to be personalized. Because even though we know so much about biology and physiology, it's way more complicated than we think it is. And it's way more advanced and intelligent than we think it is. We want to think that we know so much and we can simplify it down, but we are not. And so this is why having data as much as possible, whether that's data of, owners keeping food logs, like you said, and seeing how animals react to them, owners, doing, free interventions to, improve pets' stress levels, exercise, exposure to sunlight, all those things, or whether it's being a little bit more personalized and digging deeper and investing some money into some of these tests, like we've been mentioning. It's really important because every single individual is so individualized and has their own specific needs.
I love that. Um, in the pet industry now, we have a ton
Mhm.
of pet friendly tests, whether
Yes,
it's your vitamin D test or your
yes,
sensitivity test. Like it's a good time to be a pet owner.
totally.
And
There's
so
so
you
much
have
you
a
can take into your own hands.
yeah, because I've
Mhm.
had tons of people
I've got water.
itchy dogs. I'm like, did you do an allergy panel? Well, it's like $500 at the vet. They just do the Apoquel. I'm like, so they're willing to give Apoquel, but not willing to figure out what the cause is. And the answer is always yes.
Hmm.
They'd rather do the Apoquel. I'm like, sensitivity test is like $130. And they're like, that's cheaper than my vet visit.
Hmm.
Well, go for it.
Yeah.
Yeah.
Yeah, it's they're all really helpful because at the end of the day, no matter how much your veterinarian loves their job and loves your pet, you're still the best advocate for your pet, just like you're the best advocate for your health. And so, I think that the culture used to be like you go to the doctor, you trust the doctor, you do what they say, but that's not how it is anymore. And that's not that's not a dig at my profession. I love my profession. My colleagues work very hard, and I feel very lucky to be here. But it is also really important that pet owners advocate for their pets in a way that they believe is aligned with what they're looking for. Just like I feel really strongly, all of us should be advocating for the health in a way that we want it with our doctors. And part of that ability and confidence to advocate comes with knowledge. And some of that knowledge can come from these types of tests where you're just learning more information about exactly what is going on for them that you can share with your vet. And some of them are open to it and some of them are not.
Yeah, it's frustrating when vets aren't open to a mycotoxin test or a glyphosate test. And what, like you've probably done thousands of them, Dr. Kendra. So how often, like 90% D deficient, 90% glyphosate, what are the numbers that you see?
Yeah. The animals that um, so most of the animals test positive for those types of toxins because most of them have been on commercial available diets. If I have a patient come to me or my colleagues that's been fed like a raw diet usually because they usually don't have any of the carbs in them, because I do see with the gently cooked, if they have carbohydrates in them, they can test positive for some of those toxins, that they can be negative or be low enough that we don't need to do anything about it. But it is a rare instance, and I cannot think of a specific case at all off the top of my head who was on a commercial diet that did not test positive for some level of glyphosate or mycotoxins, so pesticides and mold. We just expect them to be there because of the farming practices of the ingredients for those types of food.
And then I always see people proudly tell me that they are on a homemade diet, and I'll ask them, what's the calcium source? And they look at me funny and go, calcium source, what do you mean? And I'm just like, oh, so now there's this whole new trend of people just grabbing some internet recipe and not doing the basic needs, and their teeth are falling out and all sorts of debauchery. So it's scary.
Yeah.
Yeah.
Yeah, that's a shame, because there's so much really good free resources online for balanced diets that that's disappointing. And I do know that that happens because I do have occasionally a client that same thing will be going on. They've been home cooking for a long time and it's not complete imbalance. Um, and so I agree with you. I always think though also of how many of us humans are walking around with the nutritional deficiencies because they're not eating what they're supposed to either.
Yeah.
But I agree with you. Yes, when they depend on us for their food and we're not making sure that it's meeting their nutritional requirements, it is upsetting.
Right. And I don't know where they're getting these recipes. I'm like, who told you this? They're like,
Yeah.
oh, I just, all these ads about all these commercial gently cooked foods. So I just cook for myself and my dog, and I just feed them whatever I'm eating. And
Yeah.
so somehow we have to get the word out there to not to this community, but the community that's just dabbling. I think
Yeah.
it is. They're excited. They see some good results in the beginning
Yep.
because it's better than kibble, but
Yep.
long term, it's not sustainable.
Yeah. And that's so great, right? That they're motivated enough that they're willing to give of, one of their most valuable resources, their time, to do this for their pet. And so, yeah, I agree with you. It would be so great if we could get in front of them and just say, "Here, just use this instead." Then you don't have to worry about missing anything.
How about fasting? What are your thoughts on that?
I think there's definitely a place for fasting for a lot of reasons. We have a ton of research on the human side to know what the benefits are. But if we think about the typical behaviors of our dogs, they always fasted. So they, when I was doing some of this research for the course, I found some really interesting papers just about like how dogs' GI tracts and taste buds evolved over time. And it had so much to do with them co-evolving with us, which I think is really cool. And so they went from animals that ate really higher fat diets because they would scavenge on the animal parts that we would leave behind when we were gatherers to when we were more settlers and we grew grains. They actually developed taste buds for carbs because we would share our carbs with them too. And so they always needed to go through long periods of time without food. It's actually part of the reason that I don't know if anybody has ever heard of Keto Pet Sanctuary or have heard about the ketone, the ketogenic diets and kind of the ketone projects around dogs. But they develop ketones in a much different way than people. And it's actually much harder for them to go into ketosis because it's just their normal state. Their normal state can be starvation for periods of time. And so I think that fasting should be incorporated into a longevity and health protocol in some way because it is reminiscent of their ancestral normal biology. And so I think from the perspective of we know that anytime the body is receiving messages from food, it's turning it on. And so there's certain processes that clean up dead cells, that take out cancer cells, that enforce detoxification, that turn on tumor suppressors, that they don't turn on unless there's no signal. So we know there needs to be period without food for those processes to happen appropriately.
So what's your thought on the ketogenic diet? Are you like all in keto? Is it long-term sustainable, or is this a pulse type diet?
Yeah. So when we think about the benefits of ketogenic diets specifically for cancer, when we look at the literature that we have in people, it does matter how much ketosis they're in. So there are some what we call nutritional ketosis and then therapeutic ketosis. And the nutritional ketosis is better for autoimmune disease, metabolic syndrome, pre-diabetes. But for certain cancers like brain tumors, where there is a ton of evidence that these are very, very helpful, they need to be these really high therapeutic ketoses. When we look at dogs and we try to measure them to see what therapeutic and nutritional ketosis is, they just don't produce the same amount of ketones. So we're not really sure where that level is. So colleagues that I have that do this, balance these diets, they've been involved with Keto Pet Sanctuary. This is something that they utilize often. They will do these higher fat containing diets. What I have seen in my practice is that even just a low carb diet for some dogs will put a pet into ketosis.
Wow.
So this, like a lot of the other things we've been talking about today, is personalized. And so for some dogs, they need more fat, and some dogs just need less carbs, or like we just talked about, fasting to produce those ketones. I use it sometimes, and sometimes I don't. It really depends on the cancer type and how it's responding to our other therapies. If it's one of how I think about like a liver, I'm going to pull or not.
Right. And I was just thinking like liver, gallbladder, pancreas. I can't imagine a high fat diet being that beneficial. And there's new science that like melanoma thrives on fat. And so that was one of the things. My sister passed a melanoma, and my other
Mm,
sister was doing like Budwig diet with her. And
yes,
we were like really pushing the fat to her, and it wasn't working. And
yes.
then later on, that research came out, and I was just like, well, we just kind of hurt her.
Yeah. Or maybe just didn't help as much as you had hoped you would. Because we do know that fats can cause dysbiosis of the microbiome in some patients. We do know in humans that some people can't digest fats the same way as other people can, just like some of us can have coffee, others can't, red meat, others can't. There's all those things that we've learned, the, nutrigenomics that we're starting to learn that I imagine one day we'll be able to do that in animals too.
How do you think we could figure that out? I mean, Randy seems to be of VDI Labs, the thought leader in all of this. I'm sure he thinks about this.
Yeah, I know. Because he's always pulling like the every time I talk to him or anytime I want something, I'm like, "Hey Randy, I need a home assistant." And he's like, "Okay, I got it." And then we have it. So I completely agree with you. It can't be that difficult because think about all the genetic test companies that we have, like Embark and all those other ones that are already doing this. That raw data exists somewhere. We just need someone to be willing to spend the money to create a product so that we can take that raw data and get more information. Like in people, the I guess interest in this came with all the 23andMe tests because now you can take your 23andMe data and put it through some of these companies and get, like you're saying, cancer risk or tolerance of caffeine or, these other types of things. And so I think it's just going to be someone who has an interest in spending money on this company and being willing to do it.
So I would probably think about investing in that.
Right?
Yeah,
Exactly. It'd be so
I think
cool.
so.
Because it would be
Absolutely.
so much information that answer so many of these questions that I'm sure you get like I do, where people are like, well, that didn't work and this didn't work. And it's like because it wasn't appropriate for them. And so much of that is related to the epigenetics. And we don't have any good testing for that stuff at all in our pets. So I would
Not
love it.
yet. Not yet,
Not yet.
but hopefully we will. All
Hmm.
right. So what about these odd at-home therapies that you can do, like
Mm.
foot baths and
Yeah.
castor oil packs and all these
Yeah.
things that are super trendy for humans right now? What are your thoughts?
Yeah. I have definitely recommended castor oil packs. I've definitely suggested the ionic foot baths for some of my clients. Ozone at home, for sure. What are some other at home therapies that I've suggested? Red light for sure. Lasers, grounding mats. Um, there's definitely indications for all of them. And depending on what you're trying to support. That's really what so many of these therapies are doing, right? They're supporting the body's innate abilities to do what it's supposed to do, decrease inflammation, detox, heal. And so it's just those extra tools to like give it that oomph to help it get there faster, and get there, in an easier way for the pet.
Yeah. Thank
Mhm.
you. That's so exciting. Like I said, it's exciting to be a pet owner these days because there's so many new fun options
Yeah.
for everyone to explore, whether it's dog, cat, or horse.
Yeah.
Um, Exercise, suppression, exercise. I feel like animals, I have a 5 acre ranch. I have a rescue dog that runs like a banshee every afternoon. He cannot handle the heat. So
Yeah.
he like times it as the sun's going down. He gets a little happy feet. He's like, let me
Yeah.
go run after skunks. And so he's really fit now because of that. But
Yeah.
I'm not engaging with him as much because I'm sitting here on the computer. So he's kind of feral now.
Yeah, right. He's like, I'll do it myself if you won't, mom.
Yeah, and I
It's
think the
true.
skunks hate me. I think they're like ganging up, like they're positioning themselves around the house just to make my house smell really bad.
They're like,
So,
how dare you send him after us?
yeah, they're like, we're just gonna make your house unbearable. I'm like, oh,
Exactly.
yeah.
I love that. It's such an important piece, and I feel like horses are such a good example of this. Like when they're, the fancy show barns that keep them in stalls all day long, the thoroughbreds where they're never left out to graze, they all go crazy and develop these behavioral conditions and then, issues under the saddle that probably aren't issues at all. They're all related to their husbandry. And I know one of my associate doctors, she did a exotics residency, and so much of what they do is just about like you're not caring for them in the way they're supposed to be, and all their health problems will go away if they're allowed to run and play and exercise and use their brain. And so, I agree with you. I mean, us too, right? They say sitting at a desk is like a class 2 carcinogen, the same as smoking now. So it's all the same.
Oh no, that's awful.
Mhm.
I didn't know that.
Yeah,
So
well, I'm sure you get up and get around. This is like
Not
all
as
day
much
long.
as I want. Not at
No.
all. I would love to I don't get a ride much, so I would love to get back
Yeah.
riding.
I have a question in regards to the exercise. So I have a dilemma down here in Florida, about ready to move back to Jersey. With the
Too
allergies so
hot.
bad, that's why I'm going to Dr. Shea.
Yeah.
Gigi walks around, she gets bitten by a zillion ants and fire ants, and she's in the pesticide, like pesticide heaven down here. I
Yeah.
stopped walking her. I keep her in a zoned off part of my yard. I look like whatever, like a flea market. I have little no spray signs all over the place. They know not to even go near there, like they're scared to death, the landscapers. But she's not getting the same, both dogs aren't getting the same amount of walk. But when they go for a walk, they're like dust mops, picking up all the pesticide,
Yep.
the reclaimed water, the bugs. And Gigi's 100% better this summer than last year. Still a mess, but nothing like it was. So where's the trade-off? She needs the exercise. It would be good for her, but I'm not putting her body into fight and flight and cortisol and toxins. It's
Yeah.
like, I've just chosen to go that way at this point, but I feel bad doing it too.
Do you have any of those indoor like doggy gyms or like some of them have pools they can swim in or some of them have like the little like tracks they can do?
No, but I do have a pretty big lanai that it was supposed to be built for a pool when they built the house.
Hmm.
So I go out there and I try to run, but the other problem is like 100 degrees here. So you can't really do that.
Yeah.
So, I mean, Candy still will. And like today, they both got baths since we're going to Shea and they were zooming back and forth around the house and outside. But I just don't walk in the grass here anymore, which is really, really bad.
Yeah.
You need to move.
It sounds like you
I'm seriously, I'm
Ocala is calling you.
Oh, I
exactly.
don't want to go to Ocala. I mean, I actually just looked at a place, but I was thinking of coming back and moving down by you, actually, at the
Well, there you
shore.
go.
A lot of good doctors there,
Yeah.
better than here. I mean, and the problem is you have winter.
We do have winter.
You do.
So, but if I had a house at the beach, I'd be happy.
Yeah, exactly.
But winter's why we don't have all the bugs that then get sprayed for.
Right. I mean,
So
down
it's all
here,
trade
it's
off.
just insane. Like they just love Roundup and they just love all the pesticide.
It's
I know it.
tragic,
It is.
It,
actually.
it really is. And you know what? The sad part is my yard looks just as good, if not better, than the yards that
Yeah,
are
see, so
getting.
you don't even need it.
No.
Exactly.
I mean, I said to them, would you look at my yard? It hasn't been touched in 2 years. Do you see weeds? Do you see a problem here?
Yeah,
Nope.
it probably stays in the soil for a long time. I actually looked that up last week, is what's the half-life of Roundup, and I was surprised it was only like 60 days,
You
which,
know, I have found different sources. I found some just like you, Poppy, that say it's just like a few months. And I found other sources that said it's like 60 years.
well, that's what
So,
I thought it was.
yeah,
And I've been telling people it's like 60, 75 years, and then I couldn't find it again. I'm like, oh,
I
they
know.
wiped it.
I know. Well, exactly. That's what is a little bit concerning is that are we getting the full transparent information available to us or not?
And
Yeah.
then they have Roundup replacements that are safe. I said, really? What's in them? Oh, I don't know, but it's safer. Don't worry about it. And then you talked, what's really scary is I talked to the pesticide guy. I'm like, how can you even be near this stuff 24/7? And he goes, oh, it's totally safe. He sprays it on the grass, gets on his hands and knees, and licks the grass.
He's
I just
not,
Wow.
looked at
he
him
is
like, are
not
you crazy?
blue-eyed. He's So, Dr. Kendra, a lot of us are animal iridologists. So we,
Yeah,
the irises and
which
definitely
is
the
so cool.
blue and green-eyed animals are more prone to lymphatic constitution,
Mm,
sensitivities, things like that. The darker-eyed animals seem to be more systemically toxic, which is
interesting.
really interesting. And we can change the iris with detoxification.
Cool.
It's very, very cool. So we're excited. We're trying to like track cancer
Yeah.
patients. Um, I have Donna Middleton, one of my students,
Yes.
she submitted a couple of hemangio dogs, and we fully expected to see like a tumor marker or something, and
Mm,
all we saw was a blood line
mm,
around the tumor, around the spleen. So it made me think, huh, isn't that interesting that it's a blood-based
yes.
cancer and the tumor's the side effect. It's not the actual
That's so
aspect.
interesting. Sounds like that needs to be in the cancer prevention protocol and iridology screening, right?
Yeah,
For any treatment protocols. That's really cool.
it's pretty fascinating. So tumor-based cancers often look like opaque dark marks, and they're very
Mm,
circular, whereas lipomas are translucent usually.
hmm.
And they're not always there. And if the animal's on medication, that kind of blocks the nerve receptors, so they don't always come out. But it is pretty fun.
So interesting.
It is. It's really amazing and it's proactive. Like you can really
Exactly.
ahead of things just by reading the iris. I'll send you my I did my horse. He was my final exam when I got certified and sent his eyes in and then off the iris reading, I doubled his humic fulvic because his eyes were totally toxic and he was pre-Cushing's. And so I use a company called Manalife. And so I doubled their black powdery humic fulvic acid. His brown eyes went amber. It
Wow.
went absolutely bright, and he looked 10 years younger. He was zero Cushing's symptoms and lived out the
How
rest of his
cool.
life being able to eat grass and not being
That's
managed
awesome.
as a Cushing's horse.
So
Yeah,
cool. I
it
love
is.
that.
It is really fun. So detox, humic
Yes.
fulvic, we love it.
Yes.
Humic
Same.
fulvic acid is beautiful. And then if you do have blue-eyed or crazy-eyed animals, do you, I would tell everybody you have to be a little more vigilant.
Yeah. Yeah, that's so interesting. This is the first that I'm learning of that, and I love those little predispositions because there are certain things like that where exactly what you're saying, you need to be a little bit more vigilant, right? I always think about the Goldens, the German Shepherds, the flat coat retrievers, there's certain breeds that you have to worry about. So it's like it's all those points that you're like a little bit of weakness, be a little bit more aggressive here, because people will say to me, how early do you recommend a pet start a cancer prevention protocol. And I'm like, as soon as you get them, because this is something you're doing all the time, right? You don't need to be intense and crazy about it all the time, but you always are doing something all the time to be optimizing that plan that you have for them.
It's a lifestyle.
Exactly. That's
It's a
exactly what
committed
it is.
lifestyle.
Hmm.
Yeah. Oh, this is amazing.
Yeah,
Thank
this
you
is
so
great.
much. My mind is just kind of wondering, do you ever do foot baths for horses?
Right? I feel like we
Hoof soaks.
should.
We do hoof soaks. I
Exactly.
do ozone hoof soaks.
Yeah.
Those are trippy. And then so it draws heat out of the hooves and it makes a condensation in the bag.
Hmm.
So the bag
Wow.
looks like a steam room.
Wow.
It's so crazy.
Really interesting.
Do you have ozone? Are you an ozone practitioner?
Yes, we have ozone at the practice. I have a smaller unit at my house that actually I've used for myself in my home. I have autoimmune disease myself, and it really helps my joint pain. And I've done it in him once. I
IB?
I have no excuse. Yeah, I've done it IV in him. And so I need to go back and do it more. I have his chiropractor and acupuncturist taught me how,
Okay.
because she does it that way. And so I've just been a weenie and I just need
Well,
to
it's
do it.
scary shooting that much gas into the vein. You're like, oh,
And
this feels really scary.
you feel it. You're like your fingers
It's
there and you're feeling the
bubbly.
air. Oh my God, you're like everything inside of me is telling me this is a terrible idea.
It's creepy as heck.
Hmm.
Absolutely. I agree.
Yeah.
Yeah.
When he got
Topic.
his first, he was like, it must have felt weird because he kept like shaking his head, and I was like, oh my God, what is happening?
You're like, he's going to be dead tomorrow. I
Exactly. I
know.
know.
It's terrifying.
Yeah.
Yeah. And then post dental, it's awesome for that.
That's a good point. Yeah, that's so great. Yes, I'm such in my early like all of the things that I know about my dogs and my cats, I always wonder how I would do for him. So I love this because I'm like, learning as I go as a newbie horse mom.
So I do O3G orally for my
Uh-huh.
horses. I do
Uh-huh.
dilute it. It does seem to be really beneficial for overall vitality, but it
Cool.
doesn't. So I work on a lot of EPM and Lyme horses.
Yes.
And so it doesn't seem to have the stick as the IV. And
Mm.
Dr. Mark Paulo has a pre-made, a ready-to-use IV ozone with a
Hmm.
glycerin base. And so you can just draw it up in the syringe, 60 cc's, not 300 or 600 cc's in the vein.
Yeah.
So
Yeah.
it feels way more safe than
Yeah. And I know uh oh my gosh, why am I blanking on his name? Dr. Jim.
Briggs.
Yes, Dr. Jim
Bridges.
Bridges. I know that he feels really strongly that the ozonated glycerin IV is very helpful for EPM.
Absolutely. I've seen it
Hmm.
firsthand. I've seen some very sick horses come back from that.
Hmm.
So I am a huge fan of that.
Yeah,
Absolutely. Yeah.
awesome.
Fun.
So much
Excellent.
fun.